Bone fractures and falls, a comprehensive overview for older adults. Falls and bone fractures are two of the most significant health concerns facing older adults. As people age, their bones become more fragile, making them more susceptible to fractures from even minor accidents. Falls, in particular, pose a major risk for the elderly, leading to a cascade of complications that can severely impact their quality of life. Understanding the causes, risk factors, prevention strategies, and treatments for falls and fractures is crucial for maintaining health and independence in later life. This article explores the nature of bone fractures and falls in older adults, the risk factors associated with them, strategies for prevention, and treatment options that can help mitigate the consequences of these injuries. Table of Contents. Understanding bone health and aging. Age-related changes in bone density. Osteoporosis and its role in fractures. Impact on mobility and independence. Causes and types of bone fractures in older adults. Common types of fractures: hip, wrist, spine. Osteoporotic fractures. Stress fractures and spontaneous fractures. Understanding falls in older adults. Common causes of falls. Environmental and health-related risk factors. Impact of balance, vision, and muscle weakness. Risk factors for falls and fractures. Age, gender, and genetic predisposition. Medication use and its impact on fall risk. Comorbidities like arthritis, diabetes, and cognitive decline. Consequences of falls and fractures. Physical consequences: mobility, hospitalization. Emotional and psychological impact: fear of falling, isolation. Economic burden and healthcare implications. Prevention strategies for falls and fractures. Home modifications to reduce fall risk. Nutrition and bone health: calcium, vitamin D. Exercise programs to strengthen muscles and improve balance. Medical treatments and rehabilitation for fractures. Surgical interventions for fractures. Non-surgical treatment options. Physical therapy and rehabilitation. Long-term management and care. Preventing repeat falls and fractures. Role of caregivers in fall prevention. Holistic approaches to maintaining bone and joint health. Conclusion. 1. Understanding bone health and aging. Age-related changes in bone density. Bone is a living tissue that continuously renews itself through a process called remodeling, where old bone tissue is broken down and new bone tissue is formed. In younger individuals, this process is balanced, but as we age, bone resorption, breakdown, starts to outpace bone formation, leading to a gradual loss of bone density. This condition is known as osteopenia, which can eventually progress to osteoporosis if left unmanaged. Osteoporosis is a condition characterized by weakened bones that are more susceptible to fractures. It's often called the silent disease, because bone loss occurs without any symptoms until a fracture happens. The reduction in bone density makes bones more fragile and prone to fractures even from minor falls or stresses that wouldn't affect younger individuals. Osteoporosis and its role in fractures. Osteoporosis is one of the primary causes of bone fractures in older adults. It is especially common in postmenopausal women due to a decrease in estrogen levels, which accelerates bone loss. However, older men can also develop osteoporosis, particularly if they have certain risk factors such as long-term corticosteroid use, a history of smoking, or low testosterone levels. Osteoporotic fractures. These fractures often occur in areas of the body where the bones are most vulnerable, such as the hips, wrists, and spine. Hip fractures, in particular, are among the most serious and life-altering, often leading to hospitalization, surgery, and long-term rehabilitation. Impact on mobility and independence. Fractures, especially in the hips or spine, can drastically impact an older adult's mobility and independence. Many individuals who experience a major fracture may struggle to regain their previous level of physical activity, leading to increased dependence on caregivers and a decline in overall quality of life. In severe cases, complications from fractures can lead to long-term disability or even premature death. 2. Causes and types of bone fractures in older adults. Older adults are prone to different types of fractures, some of which are directly linked to falls, while others may occur spontaneously due to weakened bones. Common types of fractures.